Hello friends. So now we are going to study the next topic, that is the pharynx. Now in the pharynx, the first topic that we are going to study is the introduction to pharynx. So now what is pharynx? Now pharynx is a cavity that starts behind the nose and goes up till the esophagus. So you can see that this part, this is the pharynx, and it's a common passage for airway and food. So you can see over here, this is the nasal cavity. So behind the nasal cavity, this is the oral cavity. You can see over here tongue, right? So this is the oral cavity, behind the oral cavity, and this part you can see is the larynx. So behind and around the larynx, we have the pharynx. Let's look at the boundaries of the pharynx. Now the pharynx, it extends from the skull base. So you can see over here, that's the skull base, till the lower end of cricoid cartilage. So remember, the lower end of cricoid cartilage marks the end of pharynx and the start of esophagus, right? So that is the extent of pharynx. Now we can divide this pharynx into three parts. What are the three parts? As I just told you, behind the nasal cavity, we have the nasopharynx. You can see it in green color. Behind the oral cavity over here, so that's the oral cavity, you can see the tongue, right? So we have the oropharynx, and behind around the larynx, we have the laryngopharynx. Okay, so we can divide into three ways. Another way to divide is that from the skull base to the hard palate. Okay, so that's the lower boundary, and this is the nasopharynx, because nasopharynx is the uppermost part of pharynx, so we also call it as epipharynx, right? Now similarly, between the hard palate to the hyoid bone over here, we have the oropharynx. Okay, and from hyoid bone to the lower end of cricoid cartilage, we have our hypopharynx, also known as laryngopharynx, as it is around the larynx. And we know that below the cricoid cartilage, we have the esophagus, right? Okay, now before we go and understand each and every part of the pharynx, let's study about the wall of the pharynx. So what makes the wall of the pharynx? Now the pharyngeal wall is made up of 4 layers. Okay, what are those 4 layers? Let's say this is the inside, that is, this is the pharynx. Okay, so from inside, that means from pharynx, if I go outside, so let's say this is over here, the outside. So what are the different layers in the wall of the pharynx? So we are starting from pharynx, we are going to outside. This I will assume it to be basal layer, or I can say it as the basement membrane. So whatever you want to say, this is just hypothetical name I have given over here so as to learn the different layers of pharynx. Okay, so we can see the skull base. Below the skull base, we can see over here this structure, that is the eustachian tube, and then we go down and we can see the 4 layers. So number 1 layer over here is the mucous membrane. So that's the number 1 layer, the mucous membrane or the mucosa, and we know that this is your pseudo stratified ciliated columnar epithelium. This part we have already studied in the nose, that the whole nasal cavity, sinuses, pharynx, larynx, trachea, bronchi, they are all lined by pseudo-stratified ciliated columnar epithelium, that is also known as the respiratory epithelium, right? Now just below the mucous membrane, we have a layer of fascia. Now you see, this layer of fascia is near the pharynx. So we start with the name as pharyngo, and it is away from the basal layer. So we assume this layer, okay, that was just to help us with the nomenclature. So pharyngo-basilar fascia. Easy to remember, pharynx to the basal layer, pharyngo-basilar fascia. That's the second layer of the pharynx, going from inside to out. Now below that, we'll find the muscular layer. Okay, so we have the number 3 layer, the muscular coat, and the number 4 layer. Now you see, this number 4 layer is near the basal layer. So B has to come first. Okay, so this layer is known as bucco buccopharyngeal fascia, right? So this is known as buccopharyngeal fascia. So you see the B has come first, the pharynx part has gone behind, so buccopharyngeal fascia. So these are the 4 layers of pharyngeal wall: mucous membrane, pharyngobasilar fascia, muscular coat, and the buccopharyngeal fascia, right? Now, out of these 4 layers, the most important layer for us to study is the muscular coat. So let us study this layer in further detail. Okay, let's look at this diagram. So once we look at this diagram, we can see that the wall of the pharynx is made up of 3 muscles. Okay, you can see over here 1, 2, and 3. Which are these 3 muscles? These are the 3 constrictor muscles which go around the pharynx like this. Okay, so there are 3 constrictor muscles of the pharynx. They go around the pharynx like this and they fuse with each other, the right side with the left side, they fuse with each other in the posterior midline pharyngeal raphe. So you can see that this raphe, it's a midline pharyngeal raphe. So all the 3 muscles, they go around the pharynx and they fuse posteriorly with each other in the pharyngeal raphe. So which are these 3 muscles? Number 1, we can see the superior constrictor muscle. Number 2, we can see the middle constrictor muscle. And number 3, we can see the inferior constrictor muscle. So there are 3 constrictor muscles: superior, middle, and inferior. Right? Okay. Now, what else can we see over here? We can see below the inferior constrictor, the esophagus has started. Alright, so the pharynx is made up of these layers of these 3 constrictor muscles: superior, middle, and inferior. Okay, other than these 3 constrictor muscles, what else can we see in these diagrams? We can see over here the styloid process. Okay, so you can see this is the styloid process. From this styloid process to the hyoid bone runs a ligament that is known as stylohyoid ligament, and we also have a muscle that is known as stylopharyngeus muscle, right? So this muscle is known as stylopharyngeus muscle, and you can see that this muscle is entering into the pharynx between the superior and middle constrictor. Alright, so we'll talk more about this muscle. Okay, so we can see the stylopharyngeus muscle, it is entering into the pharynx between the superior and middle constrictor muscle. So it forms the another layer of the pharyngeal wall. So muscles of the pharynx, superior, middle, and inferior constrictor, they form the outer layer, and inside the inner layer is formed by 3 more muscles. Let's see these 3 more muscles. So what are those 3 more muscles? You can see over here, this is the inner view of the pharynx. Inside, in the second photograph, you can see the inner view of the pharynx, and we just discussed the number 1 muscle, the stylopharyngeus. So it comes from outside and it enters over here inside between the superior constrictor and the middle constrictor. Okay, another muscle that we can see in the second diagram, we can see the salpingopharyngeus. So salpingo means tube, eustachian tube. So we can see over here, this is the eustachian tube, and from the eustachian tube arises the muscle which is known as salpingopharyngeus muscle, right? And number 3, we can see a muscle which is arising over here from the palate, and that is known as palatopharyngeus muscle. So these 3 muscles, the stylopharyngeus, salpingopharyngeus, and palatopharyngeus, they form the deep layer or the inner layer of the pharyngeal wall. Right? Now, MCQ over here important, the palatopharyngeus. This bulge of this muscle, the palatopharyngeus, it forms a ridge. On the sides of the pharynx, it forms a ridge. That ridge is known as Passavant's ridge. This ridge, the Passavant's ridge, help us close the nasopharynx. From the oropharynx, it closes the nasopharynx so that the food is not able to regurgitate into the nasopharynx when we swallow. Okay, so that aperture is closed and the food is pushed down with the help of Passavant's ridge and the soft palate. The soft palate will go and it will strike the passavant ridge, so that aperture is closed and food does not go into the nasopharynx. So remember, palatopharyngeus starts with P and it forms the passavant ridge. All right. Now, anything else that we can see over here? We can see a very important structure over here which we are going to talk later on, and that is the palatine tonsils. Okay, so remember that these palatine tonsils, they are on the, you can see over here the palatine tonsils, the bed of these palatine tonsils, you can see they are formed by superior constrictor muscle. Okay, so just remember for the future reference that the superior constrictor muscle, it forms the bed of the palatine tonsils, right? So that knowledge we will use later on when we'll study about the palatine tonsils. Okay, all right. Now we have seen these layers of the pharyngeal muscle. Now we can see that there is a space between the superior constrictor, upper border and the skull base. So let's see over here. I'm drawing a circle over here. So you can see between the upper border of the superior constrictor and the skull base, there is a gap. This is an anatomical gap. This anatomical gap is known as sinus of Morgagni. Okay. Now what passes through the sinus of Morgagni? Four important structures pass through the sinus of Morgagni, and we can remember them with the help of the mnemonic palate. Now what do I mean by the mnemonic palate? So you see, palate we can divide into AT. AT stands for auditory tube. Auditory tube or eustachian tube. Okay. Now L over here stands for levator villi palatini. Okay. PA stands for palatine artery, ascending palatine artery. And E over here you can see, I say the E is extra, so sometimes we have a fourth structure passing through it, that is the extra structure, ascending pharyngeal artery. So let's look over here. We have number 1, the eustachian tube, also known as auditory tube. Number 2, we have the levator villi palatini muscle. Number 3, we have the ascending palatine artery. So very easy to remember, palatine artery, the mnemonic is palate. So palate, palatine artery, easy to remember. And number 4, we may also have sometimes the passage of ascending pharyngeal artery also through the sinus of Morgagni. So these are the structures that pass above the superior constrictor. Okay, you can see between the superior border of superior constrictor and the skull base, we have this anatomical gap. Now similarly, we saw that between the superior and the middle constrictor, we have passage of stylopharyngeus muscle. So this we have seen. Okay, now this stylopharyngeus muscle comes in along with its nerve supply, that is the 9th cranial nerve, the glossopharyngeal nerve. Okay. So once again, let's see what all structures are going between these constrictor muscles. So as I discussed, above the superior constrictor, we have 4 structures: eustachian tube, levator villi palatini, ascending palatine artery, and ascending pharyngeal artery. Okay. Between the superior constrictor and middle constrictor, we have the stylopharyngeus muscle and the glossopharyngeal nerve. So this we have discussed. Okay, now what passes between the middle and inferior constrictor? Between the middle and inferior constrictor, we have the internal laryngeal nerve along with the superior laryngeal vessels, right? Okay, superior laryngeal vessels, when I say, it means both artery and vein. And below the inferior constrictor, you can see over here that a structure is coming from below, that is the recurrent laryngeal nerve going along with the inferior laryngeal vessels. Once again, the vessels means artery and vein. Now both these we will study in detail when we will study the topic of larynx. But these are the structures that passes through the wall of the pharynx between the different constrictor muscles.